Your CNOS Health Watch on Siouxland News.
Osteoporosis is something you hear a lot about but can't see. Siouxland News reporter Katie Link went to CNOS to find out how to stop osteoporosis before it starts.
So osteoporosis is important because it is a silent disease. You don't have the regular markers as if you had with high blood pressure that can fluctuate wildly, or even with diabetes where you have these ups and downs in your blood sugars that kind of give you clues that something's amiss. With osteoporosis, it's very gradual. It happens over years and years, and oftentimes the first time you have any sort of clue that something is wrong is with your first fracture.
Dr. Nguyen says that osteoporosis runs in families, but is also caused by some medications or lack of calcium and vitamin D in the diet.
And the National Institutes of Health has provided us a lot of information in terms of how much calcium we should take on a daily basis. And they suggest that 1,200 milligrams is about the minimum that we would like to see.
He says it's best to consume your calcium through food instead of supplements.
A limit of about 2,000 a day, and after which you may have this increased risk for other health complications such as heart disease and kidney stones. Now, this is if you were to take it over years and years and years at high levels of calcium.
And even with advanced technology, sometimes osteoporosis gets overlooked.
Unfortunately, if we look back at the data that we have, the International Foundation, Osteoporosis Foundation, has been collecting information for years now and has shown statistically that a significant portion of people here in this country are underdiagnosed and definitely undertreated.
This means you need to be proactive and ask about getting a bone density scan.
And a lot of the times they don't put two and two together when they have these trips and falls and fracture a wrist or an arm or an ankle, and sometimes a vertebral spine, that they need to look at the density of their bones to ensure that their health is sufficient.
Dr. Nguyen says that a bone density scan once you reach menopause is a good way to find out the health of your bones.
And if you haven't had a bone density test in a while, in 5 or 10 years, and you're concerned, I think it's okay to get a screening test at that point.
For Siouxland News, I'm Katie Link.